with नमस्कार वर्ल्ड मेंटल हेल्थ डे पर माइंड मैटर्स पर आप सभी का स्वागत है. We are in conversation with a very renowned psychologist and therapist, Husna Vanjara ji. Husna ji, welcome to Mind and Matters. She will be joining us very soon. Hello, hello.
Hi.
Very, very nice to have you today, Husna. And
thank you so much, Vaishalee, for your kind words. It's an honor and pleasure to be here, and I look forward to having a superb interactive session with all of y'all. Any questions, please let me know in the chat box, and I will be most happy to answer them.
Yes, and I would like to introduce Husna. I've already done that, but I would like to say a little bit more about her, that she has been associated with CINTAA since last pandemic, and she's done a lot of work with us. And she has been giving even free sessions to our CINTAA members during the pandemic, and done a little more also, which I don't want to discuss too much. I think I don't want to discuss that. What she's been doing, her goodness is well enough to talk for her. And to start with, Husna, today, as you know, is a World Mental Day. So how do you see this? You know, like for you, what is the significance of this particular day? And during the pandemic, we've seen that, you know, a lot of people, you know, they have been calling people and they've been asking about how are you doing? Take care of yourself, you know, be physically fit, do everything, take care of your mental health. But the prime question is, what is mental health?
Mental health is all about how we think, feel, and behave. What we think affects how we feel, and how we feel affects how we behave, in a nutshell. Why is mental health so important for everybody? Okay, I want to put forth this question to the audience. Since we are all here, since we all believe that mental health is important, why do y'all feel that mental health is important? Y'all can type whatever y'all think. Anybody? Vaishalee, you tell me, why do you think mental health is important?
Mental health, I feel that it is the prime thing. It is important because of for the stability. If you don't have a right kind of mindset, as you say, or mental health, how are you going to actually function otherwise?
Absolutely.
So I think that is the key thing which anybody will require to, even for the basic functioning. We will definitely come to the professional part of it. You will definitely explain us that, you know, what it does, like for the professionals also, for sure. But just, this is what as a layman I can figure out, or
Absolutely.
I can say.
So the first most important reason why mental health is so important is because it's connected directly to our physical health. So most psychosomatic disorders like acidity, acid reflux, eczema, ulcers, PCOD are all prime examples of you not being okay mentally, and because of that your physical health is getting affected. You know, a simple thing like you're stressed about something, you get acidity, you don't eat. Simple thing, so that is how it affects your body. आम लोगों के लिए एक मैं केस शेयर करना चाहूंगी. मेरे पास एक man came to me for sessions. He is 56 years old. अब वो आदमी last 20 years से he's on antidepressants. उसके ऊपर इतने physical test किए हैं, उसके ऊपर एंडोस्कोपी किया, थायराइड का टेस्ट किया, हार्ट सब कुछ किया, but वो बंदे को चैन ही नहीं मिल रहा है. He thinks there is something constantly wrong with him. He doesn't sleep. He sleeps only for 20 minutes a day. Okay, this he's been doing for the past 20 years. Finally, the doctor said, like, there's nothing wrong with you physically. You need to go in to see a psychologist or somebody for help. He came to me for help. Through a few sessions, we found out that the man is caught between his wife and his mother for so many years. अब उसकी माँ 80 साल की है, वो माँ को कुछ नहीं बोल पा रहा है, बीवी को कुछ नहीं बोल पा रहा है. अब वो इतने 25-30 साल से ये स्ट्रेस ये आदमी अपने अंदर ही घुट रहा है. Once he came for counseling, once he started opening up, he knew how to deal with his emotions. He's much better now in a few sessions. So from not sleeping for sleeping only for 20 minutes a day, he's graduated to sleeping for 7 hours without medication. So this is how it is directly directly linked to our physical health. This is just one example, but there are umpteen examples of it being, you know, of various cases which I have dealt with being related to your physical health. Secondly, if you have good mental health, जो आपके life में normal stresses होते हैं, normal, रोज के, वो आप adequately अच्छे से आप deal कर पाओगे हंसते हंसते. It won't affect you so much, right? Thirdly, it can help you to have good, healthy relationships with people. Many a times when we are angry, when we are upset, we start snapping at people, we get irritated, we get angry. You know, कोई अगर बच्चा आता है तो अगर हम upset रहते हैं हम वो गुस्सा उस पे निकाल देते हैं. So this is another way. So it helps you to have good, healthy relationships. Fourthly, one very important point, it helps you to realize your full potential. So you don't demand too much from yourself. You know your limitations. कि ठीक है मैं ये कर सकता हूँ या मैं ये कर सकती हूँ. You don't keep on criticizing yourself for things you can't do. You know that this is my potential. मैं इतना कर सकता हूँ या कर सकती हूँ.
Like I want to ask you on this. How does one know the potential? Like you have to be that realistic enough to know that, or it is.
So that is why when you think clearly, when you think clearly, when you know कि मैं ये कर सकता हूँ या मैं ये नहीं कर सकती हूँ, you know that. But that is when you can think logically and when you can think clearly. Correct. Right? But if you're mentally not sound, or if you're mentally upset or whatever, you will not be in a position to think clearly. Then it also helps you in making the right decisions in life. See, when we are sad, we end up making the decisions based on your emotional thinking. You know, जब हम upset होते हैं, हम emotionally सोचते हैं और हम वैसे decisions लेते हैं. फिर हम गुस्सा जब होते हैं, we take impulsive decisions. Right? So one very important thing is don't take an important decision if you're mentally not 100% there. Then it helps you to be content, happy, relaxed, stress-free. So these are the reasons why mainly mental health is very, very important.
लेकिन ऐसा हो सकता है हुस्ना जी, just as I'm having a conversation with you कि जो इंसान होता है वो दिखने में तो normal लगता है, you know, ठीक ठाक लगता है, interactive communication भी अच्छा है. In spite of that, उसकी mental health खराब हो सकती है.
150%.
Really?
Yes. So you might not know as an outsider, but the person knows that something is off with me.
Yeah. So what are the signs?
I'll tell you the signs also. Yeah. So basically, the signs for mental, like if you come to know that you have a mental illness or you're not your best. Okay. Firstly, a change in your eating or sleeping patterns. या तो आप बहुत सारा खाना खा रहे हो या तो आप बिल्कुल नहीं खा रहे हो. आप बहुत ज्यादा सो रहे हो या तो आपको नींद ही नहीं आ रही है. Okay, one more thing, very important, withdrawing from people and activities you once enjoyed. So for example, अगर आप social आदमी हो, अगर आपको कुछ hobbies है, आपको नीचे जाना अच्छा लगता है, suddenly आपको मन नहीं कर रहा है वो करने के लिए, आपको पता नहीं क्यों, लेकिन आपको मन ही नहीं कर रहा है वो. या कोई आपके पास energy नहीं हो life में, you're feeling very low, no energy. You know, I have people coming and telling me, ताकत ही नहीं है मुझे कुछ करने की. Physically everything is right, physically your vitamins are right, hormones is right, everything right, but आपको मन ही नहीं कर रहा है कुछ भी, आपको लगता है मुझे ताकत ही नहीं है कुछ करने के लिए. फिर you're feeling you're hopeless, you're worthless. मैं तो useless हूँ, मैं कोई काम का नहीं हूँ, मेरे साथ तो कभी कुछ अच्छा ही नहीं होता है. It is better if I only end my life. I'm of no use to anybody. When you start thinking like that, you're getting unexplained aches and pains. You know, like lot of you're getting aches and pains, but आपको पता ही नहीं है. डॉक्टर बोल रहे हैं सब कुछ ठीक है आपके साथ, but आपको दुख रहा है बॉडी में, आपको समझ में नहीं आ रही है क्या हो रहा है. Feeling unusually confused, forgetful, angry, upset, worried, or scared. Also, severe mood swings. You know, either you're very happy, sometimes you're very sad. You don't know what's happening in your body.
Yes, and we see this in our relatives. Sometimes we see in friends also. Sometimes like बहुत जल्दी
mood off हो जाता है. You don't know what. Okay, not being able to perform everyday simple tasks like even going to the temple, cooking, household chores, work, exercising, simple things. But the symptoms have to last for 2 weeks. Okay, one off is okay. One off day, everybody goes through this, but the symptoms have to last for 2 weeks. Secondly, most important, don't self-diagnose. Google will only make you scared and anxious. मुझे उस दिन my stomach was hurting and I was vomiting, so my daughter Googled. It came to stomach cancer. So you know what, and I'm fine. So what I want to tell you is that please don't Google, because Google gives you the ultimate, the final, this thing. It might not be that bad. Like I have patients coming and telling me, मुझे तो OCD है, मुझे तो यो है, but कुछ नहीं होता है. You know what? They are just overeating.
Yes,
So
yes.
please, if you think you're feeling off, you're not feeling okay, it's okay. Everybody goes through this regularly. Just consult somebody just for help. Talk
And
to somebody.
everybody has a different symptom, definitely, because people are wired
You
different.
may have a club of, you may have a lot of these symptoms. You may have 2-3 of these symptoms. But the main thing is the symptoms have to last for at least 2 weeks.
Right. Great. And a few of my colleagues, they have been asking a few questions also to you. We will be playing them on the video. And there is one co-actor of mine, my colleague, and she has asked, Reena ji has asked a question on anxiety. Because anxiety, people say, anxiety हो रही है, as you said, कि सबको वो self, मतलब कोई self diagnose करता है, कुछ पढ़ता है, कुछ भी तो पता चलता है. तो exactly what is anxiety? क्या है वो, और how does it affect our mental health?
According to the audience, now that we have quite a few people on this chat, आपको क्या लगता है anxiety क्या है? हम सब बोलते हैं anxiety हो रही है, anxiety हो रही है. आपके हिसाब से what is anxiety? Anybody can type?
Yeah, anyone can type. If they're typing, let's see if we are getting a question.
Yeah, the answer we want. Anybody? Body's defense mechanism. Okay. What? Fear of something that may or may not happen. Right, Mihir? Okay. So anxiety is our irrational way of thinking about the future. It is what we are thinking. हम क्या सोचते हैं क्या होने वाला है. मतलब वो नहीं, that's not a fact कि वो होगा, but ये हमारे मन में, हमारे विचार में है कि हम क्या सोच रहे हैं. So आगे क्या होगा, सब बुरा होगा, मेरे साथ कुछ अच्छा नहीं हो रहा है. That is anxiety. It is our fear of the future. What we call a feeling of impending doom, that something bad is going to happen. Okay. So the physical symptoms of anxiety क्या होती है? You may be nauseous.
That it's constant fear and fear of judgment.
It's not the fear of judgment. It's the fear of judgment. What we are judging about the future.
Okay.
What we are judging about. It's all about us. Our thoughts. हमारे जो विचार है. It is all about us.
Right.
Anxiety is not external. Anxiety is what is internal in us. What we are thinking. I will give you an example also. If there are 2 people who are going for a shoot the next day, okay, one person, so the situation is the shoot, okay, which is common to both the people. Correct. One person is getting anxiety, is getting anxious. क्या होने वाला है? मुझे तो role ही नहीं मिलेगा, मैं तो खराब performance दूंगा. The other person is cool, right? So this is what I mean by it is in our head. Okay. Now, the physical symptoms, right, Nupur, are trembling, palpitations, excess sweating. Absolutely. You feel nauseous, you feel acidic, you have headaches. This is typical anxiety. Sometimes what happens is we may end up in the hospital with symptoms which are similar to a heart attack. What we call a panic attack, जो आजकल बहुत हो रहा है. Correct. Okay. So what happens is your heart is pounding very heavily. You can't breathe and you may feel like you're dying or you're going out. Okay. Right. So then the doctors would check you up and say, कुछ भी नहीं है with the heart, don't worry. Something is happening in your brain. So you need to go and to see a therapist. Right. So this is anxiety. Anxiety is what we are creating for ourselves. Right. In a nutshell.
Tejas, can we play a video of Reena Kapoor ji, because she has asked a very interesting question related to anxiety, and she wants to even to know whether there is a medication to it all. But let's play the video first.
A lot of people today, especially in our industry, go through anxiety attacks and all. So I want to know, is medication the only option? And people talk a lot about hypnotherapy also. Does it really work? And how does it work?
Yeah.
Hi, Reena. So if the anxiety is very, very acute with regular panic attacks which hamper your daily life, then you might require medication. Only then you might require medication. But at the same time, if you have a good qualified therapist and you are willing to work regularly with the therapist, take regular sessions and work on yourself, then therapy works brilliantly in such cases. Wow. Brilliantly. Okay. Now, as regards hypnotherapy, hypnotherapy is a therapy which is done at the subconscious level of the mind while bypassing the conscious mind. And it helps the client find resolutions to his or her own issues while in that state. Therapy. Right,
Okay.
Reena? Okay.
Thank
I
you.
have a question on psychosomatic disorder. Yes, Sultan, I will come to this.
Okay, I'll wait for that.
Yes, Sultan, thank you.
Yeah. So, Husna, just tell me that anxiety or any kind of a disorder, mental disorder, does it mean that it is due to only and only due to negative thinking?
No, it is not only due to negative thinking. So there are many factors which affect your mental health. Okay. Amongst others, some of the main causes of mental illness, A is biological, which could be in the genes, or there could be a chemical imbalance in the brain. Okay. But only a certain percentage of the population is affected by this. Okay. Then you come to life experiences also have an impact on your mental health, which is very common. So first thing is trauma. Parental divorce. So if a child, even now who's an adult, has witnessed terrible parental divorce, fighting, domestic violence, alcoholism with the father, father ill-treating the mother, parents being in a toxic marriage, that also can affect your mental health even now. So with such people, normally what we've seen is they have a problem in having healthy relationships within their marriage also. So this is one thing. Secondly,
parents का अगर मतलब बुरी रिलेशनशिप देखी है तो अपनी रिलेशनशिप भी
बहुत टाइम होता है. It carries forward from there. So when they come for therapy, the actual reason is something else, which I will be giving you another example for this also.
Okay.
Another thing, intense bullying. आजकल बहुत सारा cyber bullying भी हो रहा है. That also affects your mental health.
Is it trolling? That is also a part of it.
Yes, of course, trolling is a part of it. Yes, 100%, it is a part of it, right?
Yeah.
It's again how you react to it, how you think about it, right? Okay. Then one more very important thing, when parents keep putting you down. Okay, so I will tell you a very interesting case. I am working currently with a 52-year-old man who's top-notch in a multinational company. Okay, he's top-notch. He came to me for the simple symptom that he is making many mistakes at work. So his boss was going to complain to the HR that this guy is making mistakes and need to be thrown out of his job. So he came for therapy. अब therapy करते करते पता चला कि उसका boss बहुत toxic था. So the boss would keep telling him, तुम तो useless हो, तुम तो ये हो, तुम तो वो हो, तुम बेशरम हो, and तुम्हारे से तो कुछ होगा नहीं, तुम worthless हो, तुम ऐसे बोलता था वो उसका boss उसको. अब ये तो बहुत लोगों के साथ होता है. It's a normal occurrence. It happens with many people. Now his boss was doing this with other colleagues also. Okay, at the workplace. This guy took it personally. Can anybody tell me why would this guy take it personally?
Maybe he himself was a little low on confidence and the boss just said
okay, why was he low on confidence? Now he's a top guy in a multinational company. He's got thousands of people reporting to him due to low self-esteem. Absolutely. Okay, now Remya has said due to low self-esteem. Self-esteem कहाँ से आया है? जब वो बड़ा हो रहा था वो बच्चा triggered memories.
Triggered memories, yes.
Conditioning. So ये कहाँ से root cause कहाँ से है? जब ये बच्चा बड़ा हो रहा था, he was very different from his dad. His dad was good in carpentry and like small things he would fix in the house and very hands-on. And this child was different. So from the time this boy was growing up, his dad would tell him, you're worthless and you're useless. And the same things what the boss would tell him now. Okay. So that brought back all this. So now for me as a therapist, I don't have to work with the mistakes at work. I have to work at the childhood level.
Oh my God.
So you understand how it is all connected from one thing to the other, to the other, to the other. So this is the tip of the iceberg, but uske niche itna sara hai. Right?
So again, when you're the same patient, if we just continue to talk about that, you have to go on that level, like you have to really go on the childhood level to treat him. So how do you go about it? Like because
so that is the whole process of therapy. No, I can't get it.
No, it is not. Yeah, definitely therapy.
So we have found the cause. The cause is the childhood. As a therapist, I have to work on the childhood.
And it depends on the sessions, like how many sessions would it take a normal or like 10 sessions, 20 sessions?
That depends. Therapy is a two-way process. Okay, the client meets me once a week, max twice a week. Okay, the rest of the week you have to work hard on yourself. So there are people who work hard, there are people who don't work hard. So it depends on how much input you are also putting in. It's a two-way process. It's not only on
because that is also very important.
Right. Then life experiences also, sexual abuse, emotional abuse, physical abuse, very, very important. Now again, OCD. Currently working with a 25-year-old doctor, OCD. अब वो क्या करती है, वो नहाती रहती है तो बहुत नहाती है, ओके, और पीरियड होते हैं तो नहाती नहीं है, बिल्कुल नहाती नहीं है वो, ठीक है. अब इसका रूट कॉज क्या है, नहाती है मतलब she takes bath for 2 hours every day, ठीक है, and when she has a period 10 days she just won't take bath. Root cause again, now OCD everybody thinks oh cleanliness and fixation for cleanliness. Root cause something else. She was abused as a kid. This is bringing back memories now. So what is happening is she is viewing her body as dirty. So when she's not in her period, she's thinking my body is dirty and she is cleaning herself. Okay. But when she has periods, according to some religions, your body is anyways dirty. So she doesn't need to clean herself. So you can imagine how it impacts you in different ways.
Right.
So then after life experiences, you go to personality factors. Now, some people are more resilient. They're just built that way. Okay, so if there are 2 children who have come out of trauma or have seen a traumatic marriage of their parents, one may get very affected, one may not get affected. That is because of their resilience, their own inbuilt resilience. Lifestyle, very important. So your physical activity, too much or too little, substance abuse, your drugs, weed, alcohol. आजकल यहाँ के सारे बच्चे हम weed ले रहे हैं. अरे, it is safe in Canada, yeah, it's legal in Canada, we'll take it.
Yeah,
that's the way they think. Okay.
Right.
Junk food, unhealthy food, lack of sleep, very important. If you don't get sleep, the next day you're cranky, and if you don't get sleep for 5 days, you're gone. You're a novice slave.
True.
Very important.
And many actors, like we work in a field where we have very erratic.
Yes,
moods.
Erratic. So make sure
lack of sleep is a very
important thing. Yeah? So make sure that he आप रात में नहीं सो रहे. Make sure in the day you compensate for your sleep, if possible. Not by sleeping like हम मतलब 1 घंटा ले लिए, फिर आधा घंटा ले लिए. Scattered sleep throughout the day also doesn't work. You need a good uninterrupted at least 6 hours of sleep. So make sure somehow you get it instead of spending time at the gym. Sleep, sleep, to recharge your batteries. So this is how mental health, the other factors which affect your mental health also.
Correct. We have a video on overthinking issue.
Very, very, very important.
Because one of our co-actor and CINTAA member, Karan Khandelwal, has asked this question. So we'll just go to his question also.
तो मेरा सवाल ये है कि आई हैव दिस ह्यूज प्रॉब्लम ऑफ ओवर थिंकिंग, और मैं कभी कभी इतना ओवर थिंक कर लेता हूँ कि मैं बहुत नेगेटिव हो जाता हूँ. कुछ लोगों ने कहा कि मुझे योगा करना चाहिए, कुछ ने कहा कि मुझे मेडिटेशन करना चाहिए. मैंने दोनों करके देखे, पर मेरी ये प्रॉब्लम अभी तक सॉल्व नहीं हुई है. सो प्लीज हेल्प मी आउट कि मेरी ये ओवर थिंकिंग की प्रॉब्लम को मैं कैसे ओवरकम करूँ. थैंक यू.
जी हुस्ना जी,
this is a very, very common problem which everybody has, and I'm so glad he brought up this question. So Karan, overthinking is all about creating anxiety for yourself. The more you overthink, the more you get worried and scared. And the more scared and worried you get, the more anxiety you will create for yourself. And anxiety is a negative emotion. So then you get caught into that whole web. So I will give you some simple techniques on how to how do you stop overthinking. So when you overthink, you are actually visiting the future. You're not in the present, right? Your mind is running towards the future. So this technique called the grounding technique will get you into the present moment. So what you do is 5 things you can see around you, 4 things you can hear, 3 things you can touch, 2 things you can taste, and 1 thing you can smell. So 5, 4, 3, 2, 1 is the grounding technique. It will bring you back into the present. It will curb your overthinking. Once you are back in the present moment, ask yourself, is this a fact or is this an imagination? So this situation, what you are going through or you are experiencing or you are going to experience is the fact. But everything about it and your thoughts are all in your head. Right? So you need to work on your thought because you are predicting the future. It is not accurate. So this grounding techniques works very, very well with overthinking. Secondly, even the fact versus imagination. very well. So you analyze for yourself, ठीक है, कल मेरा shoot है, okay, fine. थोड़ी बहुत anxiety is good anxiety, is healthy anxiety. It helps you gear up better, it helps you perform better. But when you realize that it is becoming a part of your life, this whole overthinking process is when you need to stop and check. So for example, I had one client, one of the CINTAA actors only who came to me, he used to get very nervous. Shoot होता था next day और इसको बड़ी anxiety हो जाती थी बंदे को. तो ये सब सोचते रहता था. एक बार तो उसने सोचा, like the first session he came to me, मैम मुझे अगर नहीं मिलेगा शूट तो पता नहीं मुझे क्या होगा, मुझे पैसे नहीं मिलेंगे, और मुझे पैसे नहीं होंगे तो मेरी शादी कैसे होगी, शादी नहीं होगी तो बच्चे कैसे होंगे, तो बच्चे भी नहीं होंगे तो मैं क्या करूंगा लाइफ में, मैं ऐसे ही मर जाऊंगा. So you can imagine the situation is the shoot tomorrow, but look at the overthinking what he has gone. So once he was taught to cut his thoughts, he's fine. He's absolutely fine. And it hardly took me 2-3 sessions to get to it. And he's absolutely okay now. Also, if it is a regular issue which interferes in your thinking very, very often, you know, अक्सर हो रहा है आपको, अब योगा नहीं हेल्प किया, आपको मेडिटेशन नहीं हेल्प किया, then there is no harm in talking to a neutral person like a therapist and getting it over for once and for all.
True.
You know, so it will help you. So the main thing is the grounding technique, what I said, and fact versus imagination.
Right. Ramya ji's question is there, okay, how to build more faith in oneself in spite of negative surroundings.
Okay, so this questions we'll come to later.
Sure.
We have everything on chat, na? Huh?
Yeah, we have everything on chat. And related to the same question, जैसे हम लोग negative thinking की बात कर रहे थे, और see हम लोग बचपन से यही लोग, हमारे friends होते हैं, हमारे बुजुर्ग होते हैं, बेटा हमेशा you know positive think किया करो, positive think किया करो, negative think मत किया करो. See जो बोल रहे हैं तो उनको समझ में आ रहा है, लेकिन जो actually the person who is going through, उनको तो समझ में नहीं आ रहा ये difference. तो ये डिफरेंस क्या है पॉजिटिव और नेगेटिव थिंकिंग, और अगर आपकी नेगेटिव थिंकिंग है तो उसको पॉजिटिव में कैसे हम पलट सकते हैं? हाउ, दैट इज आल्सो वन वेरी वेरी इंपॉर्टेंट थिंग वी वांटेड टू टच. और हमारे पास ऋत्विका जी का भी एक क्वेश्चन उसी संदर्भ में है, तो हम वो क्वेश्चन भी लेंगे और आपसे जानेंगे कि भाई कैसे, मतलब बोलते हैं लोग कि नेगेटिव थिंक मत करो, लेकिन करे क्या बंदा?
Okay, so can we see her question also, and then I'll do both together?
Sure, sure.
मेरा एक सवाल है, दिमाग के दो पहलू होते हैं, पॉजिटिव और नेगेटिव. जब इंसान के दिमाग में नेगेटिव पॉजिटिव पर हावी हो जाता है तो कौन सी क्रिया करनी चाहिए जिससे ये नेगेटिव हट जाए और पॉजिटिविटी आ जाए? क्योंकि दिमाग से बढ़िया और कोई उपजाऊ जमीन नहीं है. इसमें आप जो भी सोचेंगे, जितना ज्यादा सोचेंगे वो उतना ही उपजता रहेगा. So I just wanted to know how to avoid this negativity.
Okay, so positive thinking doesn't mean that you do not get negative thoughts. Everybody gets negative thoughts. It just means that you don't let these thoughts control your life. So the problem occurs when we get involved in a thought which is negative, which then leads to another negative thought. And before we know it, we are caught in a web of all these negative thoughts. So a bunch of negative thoughts leads to a negative emotion.
Right.
This is how it is connected also.
I hope Retwika ji has got her answer.
Yeah, no, I'm going to stress more on this.
Sure.
So there are different ways of dealing with it. Whatever works for everybody. Okay. So when a negative thought enters your mind, you can either change it to a positive thought and keep focusing on the positive one until you are sure that the negative one has been replaced. One.
That's very conscious effort one has.
Very
to
conscious effort. Okay.
Okay.
Secondly, you change the illogical thought into a more reasonable thought process. For example, I have clients come, a simple client came for she was getting very anxious कि physically मुझे कुछ हो जाएगा, ठीक है? तो सब कुछ करवा दिया, अभी उसको कुछ यूरिन का इन्फेक्शन हो गया, तो वापस वो एंजाइटी हो गई. So now how will she change the illogical thought कि यूरिन इन्फेक्शन हो जाएगा तो क्या? तो मुझे ये होगा, मैं हॉस्पिटल में हो जाऊंगी. You know that big web. Again, now how would she change it into a more reasonable thought process? It's okay, it's a urine infection, it can get cured, no big deal. So when you say this, you feel better. Right? So you change the illogical thought into a more reasonable thought process. Say stop to yourself and evaluate the negative thought process yourself. Many people also write down the negative thought and then see if it's realistic or not. Another thing what you can do is, what I also do, you acknowledge the thought. Don't dwell on it and move on with what you're thinking. So don't give it importance. The problem is there when we give it too much importance. What problem hota hai?
True. Very
Take
true.
the bull by the horns. ठीक है, जो होगा देखा जाएगा यार. So these are some of the tactics you can use by yourself, whatever works on yourself.
I think Sultan just said the same thing. There is also a problem of overacting on some of the very trivial matters. So that is also one of the things is there on the chat, if you can see.
Okay.
So as you said that, that positive thinking is, the positive thinkers need not be somebody who doesn't think negatively at all.
Oh, all of us get, na? It's very unrealistic to say that you won't get negative thoughts.
लेकिन negative thoughts को control करना वो हमारे बस में है.
वो हमारे बस में है, वही मैं बोल रही हूँ. तो या तो आप ग्राउंडिंग टेक्निक करो जो मैंने आपको पहले बोला है, आप thought versus imagination करो, या जो अब मैंने ये बोला है, stop to yourself, evaluate the thought, write the thought out, see if it's a realistic thought or not, work on it yourself.
Correct.
So the thing is that positive thoughts सबको नहीं आते हैं हर time. It's not possible only. How can it be possible?
और हुस्ना जी, अभी हम लोग मतलब सोशल मीडिया डिप्रेशन सिम्टम्स इससे भरा पड़ा है. आज
सेल्फ डायग्नोसिस अगेन.
यस, क्योंकि आप अभी देखेंगे तो एवरीबडी डिप्रेशन, एटलीस्ट इंडिया में तो हमको पिछले 3-4 साल से कुछ ज्यादा ही सुनाई दे रहा है. पैंडेमिक के वक्त तो और भी ज्यादा सुनाई दे रहा है. इससे पहले हमारे यहाँ पर एटलीस्ट इंडिया में डिप्रेशन सुनाई देना इतना ज्यादा नहीं था, लेकिन अब तो मतलब बिकॉज ऑफ द सोशल कंटेंट ऑल्सो, एंड एज यू से कि गूगल पर लोग गूगल करके देख लेते हैं कि भाई डिप्रेशन क्या है, उसके सिम्टम्स क्या है. तो ये डिप्रेशन, सैडनेस, मतलब आर दे डिफरेंट? Is it a part of it? What is it? What is depression? What is sadness? How is it affecting? And why the social platform is giving it such a high lift to this symptom or this disease?
So sadness is, everybody is sad at some point or the other in your life, right? You feel low, you feel upset when things don't go away, when somebody close to us passes away, when we don't have enough money, when we don't get a role or a job what we wanted. So we all feel sad at some point or the other in our life, but that feeling goes away after some time. We continue with our normal life, right? एक दो दिन हम sad होंगे, एक दो दिन हम रोएंगे, करेंगे, but उसके बाद में तो हम अपने आप से हम ठीक हो जाते हैं. Okay?
Right.
So sadness is temporary and it doesn't really affect our day-to-day functioning. Whereas depression is a clinical mood disorder that affects how we think, feel and behave. That is the main difference. Okay. अब depression में क्या होता है? In such a situation, we have a lot of sadness. The person doesn't communicate with anybody. They have a low mood. Lot of anger होता है depression में. Demotivation होता है. Past के बारे में guilt होता है. अब anxiety is about worry about the future. Depression is living in the past. That is the difference.
He's asking, is lack of hope also one of the symptoms of depression?
Yes, I'll just see that. Yes. 1 second. Huh? Okay. So you have a lot of guilt about the past. You blame yourself for past mistakes. Basically, you're living in the past. A feeling that life is very unfair. Feeling of hopelessness. Nothing will get better. मेरे साथ कभी कुछ अच्छा नहीं होगा. मैं अगर मर जाऊंगा ना तो ही सब ठीक हो जाएगा. Too much sleep, too little sleep. Again, eating what somebody is saying, that too much food or too little food. Sometimes people just don't eat when they're sad. Or when they're sad, they eat a lot. They overeat. So either extreme. General feeling of fatigue. Unexplained aches and pains again. मेरे पास पेशेंट आते हैं बोलते हैं मैडम हमको कुछ करने का मन नहीं करता है, हमको बेड में से उठने का मन नहीं करता है, हम स्ट्रगल करते हैं उठने के लिए and then we go back to sleep. So they just view every day as being a burden on them. But the most important aspect of depression is that the person starts thinking very, very negatively, talking negatively, thinking negatively, and then they start thinking of suicide, which is first an idea or a thought. And then it becomes a reality. Okay, now suicide. Just a short thing about suicide. Suicide is about ending the pain. The person doesn't know how to end the pain. So they feel that if they end their life, the pain will go away. So it's not always about dying. It's about just ending the pain. अपने ये कैसे pain end करूँ? तो उसको और कोई समझ में नहीं आ रहा है, तो he resorts to suicide. So what are the warning signs? Supposing some friend of yours, you feel that, okay, you can look out for these signs if after this webinar, if you think that the person is actually depressed or he or she needs help. So maybe if they talk about killing themselves, harming other people, very strong feelings again of hopelessness, kuch acha nahi hoga, aage to sab bura hi hai. Sometimes people even call other people to say goodbye. ठीक है यार, चल बाय, हाँ अभी पता नहीं कब बात होगी हमारी, that kind of talk they also do. So if anybody talks to you like that, there is no harm in just asking the person, are you okay? That's fine. Saying things like everybody will be better off without me. Unusual preoccupation with death or dying, very important. Again, कोई बंदा आपके WhatsApp group में या family group में या friends के group में बहुत active रहता है, suddenly वो बंदा या तो चुप हो जाता है या तो group से निकल जाता है. Again, a warning sign, trigger alert. So just call up and ask the person, are you okay? Would you want to talk? Would you not want to talk? So many a times, even when they just talk to somebody, they are okay about it. So this much we can all do. It's within our means to do this.
To check on people.
To check on, especially the pandemic has taught us this. Pandemic has taught us how important human life is. So,
right.
It's really taught us this. People have started realizing the importance of human relations, of connections. So make sure you connect. If people don't message you, people who you are used to meeting every day, talking every day for if they don't message you for 10 to 12 days, message, ask them, sab theek hai kya?
Right.
Chota things, what we can all do.
Thank you. Thank you for such an important tip, Husna ji. Thank you so much. And we all are very emotional people. All of us. Human beings are made up of emotions. But coming to actors, we play emotions all the time. So what happens is sometimes there is too much of emotional built up what we are going through in the personal life. Especially when my colleagues in television, especially we are all women, who are playing very different varieties of roles, and they are going through something or the other in their personal relationship, and the emotional burden on women is always very, very high. Or rather they take it. They're the women. They're the receivers, so they generally take that emotional burden, and that particular burden is so high in so many women, and be it with children, with family, with even like a breakup or something like that. Women go through the worst. What will you suggest for them, and what should the women do in that particular?
So we are thinking women go through the worst because women talk about it. We are not thinking how much men also go through, but they don't talk about it.
Yeah. Yes.
Right. So it's not only women are going through it, darling, but women talk about it. Women express their emotions. Women can cry it out. Okay. Nobody judges them. But
I would like to say that, women are also multidimensional. They are doing so many things. They are, she's a caretaker of a lot of other things like the children, the house, the baniya, the istriwala, her own career. And in that career also, there are so many aspects to her career, everything, a lot of other stuff also, which at least men, of course, I'm not trying to differentiate between men and women here. I'm just trying to say that the basic wiring of a woman is like she's too multidimensional. She's already doing too many things, emotionally invested everywhere. Basically, men have this cutoff point where if they are invested somewhere like in their career or something, they manage to cut off. At least they look like that to us.
They look like that. They don't. You won't believe it. Most of my patients are men. Not women. So the poor man has nowhere to go to. The poor man has nobody to talk to. The poor man cannot show his emotion because he's been conditioned right from birth that you can't show your emotions. That's the difference. So men are also juggling multiple roles. I agree. Women are also juggling multiple roles. But we need to realize that every individual is playing a role. For example, if you take me, I'm a mother, I'm a therapist, I'm a wife, I'm a daughter-in-law, I'm a daughter, I'm a friend, I'm a sister. So many roles you're juggling. Okay. So if one role you're not perfect, you can't let it affect your other roles. So what we do is, एक role हमारा ठीक नहीं जाता है ना, we try and attribute it to all the other roles we play in society.
We take a question of Deepshikha because she's asked on relationship. So let's take her question here. And I hope Deepshikha will be, she'll get her answer from you.
Hi, Husna Vanjara. I want to ask a personal question. Tell me, why do women suffer from depression? Especially it comes on relationship, of course, work, but I think emotions. Why they become so emotionally overwhelmed that they can't handle their emotion and they go to depression. Whether it's a breakup, whether it's children, whether it is anything, I want to know. And what is the solution for that? That is more important. Please answer me.
Thank you for this interesting question, Deepshikha. So as I just said, it is not true that only women undergo depression. Men also undergo depression. It's not, but it's just that women are more prone to expressing their emotions, including crying. It's not frowned upon by society. If a woman cries, हम बोलते हैं बेचारी. आदमी बोलता है, आदमी रोएगा public में, तो हम बोलेगा क्या यार होता है, आदमी नहीं है. That's the normal tendency which people have. कैसा आदमी है यार, रो रहा है ये. You know, we normally have that tendency. That is how we are conditioned. Right?
That's a social
conditioning, right? So women can share openly what they feel with their family and friends without the fear of being judged. Again, men on the other hand are unable to spell out their emotions from a young age, as they have been conditioned not to express their emotions. They are conditioned to put up a strong face. They can't be perceived as weak. Okay, so when a marriage breaks up, for example, a man also feels equally bad, right? Because he has also invested time, effort, everything in that marriage, and it doesn't break up, and it doesn't work out. But when the woman cries and the woman tells people, हम बोलेंगे बेचारी है यार, और जब आदमी रोएगा कोई friend के पास, वो बोलेगा क्या पागल जैसा रो रहा है यार, शादी टूटी है. You understand? That's the difference. So, as I said, most of us are also, all of us are juggling many balls. Spouses, parents, working, kids, etc. So if one ball fails, then we allow even the other ball to fall, and our life goes completely topsy-turvy, and we end up getting anxious and overwhelmed, as she said. So at that crucial time, you first need to let out your emotions, identify your emotions, because there are various emotions you go through. See, even when you're upset, there is anger sometimes, there's guilt, there's sadness, there are so many emotions. So you identify your emotions, get out your emotions, address them, lean on your support system, whatever support, whoever you have in your life to lean on, you know, like a friend to cry on, or your parents, or something, somebody in your circle. Try mindfulness, try yoga. If nothing helps to calm you down and to get your life back into track, then please try therapy. So we will try to put you back into the juggling act again. At this note, I want to also say that currently, men, I'm very, very glad that men are more open to taking care of their mental health, because the poor men have nobody to talk to. So most, as I said, most of my patients are men, even from CINTAA, most of them are men. So that's a very, very positive sign that men are realizing that, okay, we also can feel. And we also have the right to express our emotions.
Yeah. I think,
so Deepshikha, I hope I've answered your question.
Yes, I think Karan is online and he's asking you to, can you please repeat 5, 4, 3, 2, 1 for me?
Yeah, I will. 5, 4, 3, 2, 1 is called a grounding technique, Karan. 5 things you can see in the environment, anything you can see to get you back into the present. 5 things you can see, 4 things you can hear, 3 things you can touch. Touch meaning आप आपके बाल को हाथ लगा लो, आप आपके nail को हाथ लगा लो, आप you know, like you can just touch your skin or your cloth, anything which is available to you at that moment. 2 things you can taste, and 1 thing you can smell. So 5, 4, 3, 2, 1. Right, Karan?
So if he's overthinking, he has to do 5, 4, 3, 2, 1.
5, 4, 3, 2, 1. Yeah.
And immediately he will
immediately you come back into the present.
Oh.
Then you can even do deep breathing if you want to get you back still calmer, and then you do the fact versus imagination. So once you do the fact versus imagination, you get clarity. कि ठीक है यार, कल shoot है, big deal. But by me getting so worked up, I'm going to screw it up even further, and it's only in my head. Got what I'm saying? So when you sit and jot it down on paper, when you think actively, that is the time when you actually realize what is overthinking all about.
As you said that, when you jot down your thoughts, lot of people say that whatever you think, आप जो भी सोचते हैं लिखा करो तो आपको पता चलता है कि आपका सबकॉन्शियस माइंड कैसे वर्क करता है, आपका कॉन्शियस माइंड कैसे वर्क करता है, whatever. और ज्यादातर ये चीजें आप बच्चों को भी सिखाते हैं कि because if somebody is very aggressive, you just say कि अच्छा ये लो पेन पेपर लिख लो, मतलब क्यों गुस्सा आ रहा है, and you start forming your own journal, so you know exactly how you are thinking, why you are thinking, and गुस्सा आ रहा है क्यों आ रहा है, किस पर आ रहा है. So we also as a guardian or a parent, we know कि भाई what is going in that child's mind, because we always we want to concentrate on children and how do they think, because we do so many things as parents and guardians to give them the best of the education, give them the best of the exposure. We are doing all these things. When you see parents, they're like the children have become like, they are always, they want their children to do the best, be the best. The children themselves have so much pressure.
वही गलत बात है, because we want our children to be the best. That is the first mistake we parents make.
Correct. So I'm coming to this point where what do we do? How do we take care of our children? Because every parent, according to them, are doing their best. But what is good mental health for a child? What is the basic thing a parent should and should not do?
Let the child be. Let the child be. आजकल के बच्चे नीचे नहीं जाते खेलने. अभी तो फिलहाल लॉकडाउन है तो चलो नहीं जा सकते. But the children don't go down. They're running from one class to the other class. I'm not talking of older kids. Chalo 9th and 10th you have to do it because your marks are important. Which college you get into is important. But I've seen even younger kids, 3 years old, 4 years old, they are not let to be running from one class to the other class. So just let children be. We all have grown up normally. We all have played and we are fine. That's the main thing. Just let them be. They want the house to be spick and span. But always remember, a perfect house is a not so perfect life, because जहाँ बच्चा होता है वो घर perfect हो ही नहीं सकता है. वो थोड़ा mess इधर होगा उधर होगा, ठीक है. Let the child be. Let the child explore nature. Let the child play. Teach the child kindness. Very important, which I have realized today's children don't have. Teach them how to be kind. Don't take them to orphanages only on their birthdays to put pictures on Facebook how they have done charity on their birthday. No. Teach them about underprivileged children. Teach them how lucky they are in life to get what they have. Secondly, nowadays, a lot of children to get into foreign universities are doing this social service. So they start in the 9th standard. So that is, again, they are doing it for a cause because they want to get into the best of foreign universities. So again, teach them the true essence of doing social service. So when they do for others, they learn how important it is to how blessed they are.
True.
So this is some of the tips you can actually sit with your child, talk to your child, don't judge your child. See, very common when a child comes and tells you, Mama, I want to tell you something. You won't shout at me. As a parent, you say, नहीं बेटा बोलना, नहीं डांटूंगी, promise. ठीक है? वो बच्चा आपको कुछ बोलता है. First reaction as the parent is to shout at the parent. At the child. बच्चा क्या सोचता है? माँ ने तो promise किया, she won't shout at me. Now she shouted at me. Where is the child going to come and tell you again?
Right.
So talk to the child, talk nonsense with the child, learn to get the child comfortable with you. Children and nowadays 3rd, 4th standard are getting crushes on the opposite sex, okay? But they don't feel comfortable in telling their parents about it. I have children coming and telling me 7th standard, 6th standard, Miss, we like this girl, Miss, we like that boy. Okay, yaar, it's natural. You can't tell them don't. You have to tell them it's an emotion, but some things you can't do at this age, right? So understand what the child says. Very important.
Do you think, Husna ji, that in today's time, the children are more mature, like what we were at the age of 7 or 10 or 15? You see the child who's 10 today, and you talk to them, and you feel that, oh my God, I was not this smart even when I was in.
They're because of the exposure there, no?
Right.
Social media, school. Now, I went to the same school as my daughter, but you see them, they are much smarter than what we were at their age. Much smarter. And the same school. Right. You know what I'm saying? So it's just that generation that they're exposed to so much more. So if they don't get that comfort in the family, where will they go looking out for comfort?
Right.
Secondly, you talk to them openly about sex. Many parents don't. Sex is a natural thing in life. Talk to them, teach them safe sex. Don't tell them don't have it. They will have it. Teach them what values are, what the child does, outside the house, not what the child is in front of you. Right? So I've got
nice thing what you said, that the values is what he or she does outside the house and not what she does in the house.
माँ बाप के साथ तो सब बच्चे like are innocent, like you know, and my kids who come to me for therapy tell me also, Miss, my mother doesn't know, yeah, she thinks that she doesn't think, because in front of the parents they change, they are so good that they just, the parents can't believe it. So these are the some things. Listen.
Sometimes the parents are in denial when they actually come to know what's happening outside. They're in denial because they've never even imagined.
They can't imagine.
And the child is so smart in putting it up, you know, in front of the parents, you know, because they know that if I'm going to do something, what they don't like, my lot of things are going to get restricted.
Yeah.
And, so they're very smart.
So they put on an act. They put on an act to be a perfect child in front of the parents, and outside they're doing everything.
True. And we have so many cases like this.
So many cases.
You must be having a few which you can share maybe, or something.
Yeah. So I know this kid who's like 15 years old. He's perfect in front of his parents. Mother like usko पूछती है. Okay. अब वो जब school जाता है, he abuses the teachers on their faces. He gives them the choicest of bad words on their faces. When the school called the mother, the parents refused to believe that their son could do this. Refused to believe. They fought with the teachers. My son can't do it. Then during the concert, again he got up and he abused the coordinator and dirty bad words in English. Again the parents were called. Till date, they cannot believe it that this child does this. Now this child, parents ke samne perfect hai. Obviously there was some party. He went to the party. He got drunk. He came drunk in the building. Everything. But they still just, you know, theek hai na, bacha hai. Theek hai, bacha hai. This is one case. One more case I got. A very small 7th standard boy. Parents used to put pressure on him. Now parents are saying we have stopped putting pressure on him. Okay, but the damage is done. That boy has become perfect. Wants to be perfect in everything he does. Ek maan kamata hai, bichara wo. You know, he starts crying and weeping and all that. So this is the harm parents do on their children. These are just 2 cases. There are thousands of other cases actually.
Right. Just one request. Manu Srivastav ji, please आप अपना जो mic है वो mute कर दीजिए. Thank you so much. Sorry.
No problem. Yeah, so this is how parents, you know, so we all mean well for our children, of course. We all want to do the best for our children, of course. But somewhere we also have to learn that children are not our extension. They are their own individual beings.
Jayaji is saying that don't give them each and everything they ask for on a whim.
Yeah, that's also true. But they have to learn to value also what they get.
Yes, that's exactly.
That is important. You give them because we have the means to provide, right? But at the same time, every parent wants to give to the best of their ability. Yes. So don't give them whatever, like if they ask you for something exorbitant, of course not. But once they learn the value of things, they will not even ask you for everything. I see that in my own daughter.
I'm going a little longer on this because we do have child actors who work in television and definitely films. And the kind of image building they get at that particular age, the popularity, money, success. And suddenly when their part in the show or in the film is over, and maybe, you know, the second commitment what they get is not that good, इतना अच्छा नहीं मिलता उनको काम आगे जाकर, तो उतने से बच्चे में बहुत सी नेगेटिविटी, डिप्रेशन ये हमें देखने को मिलता है. एंड व्हाइल द शो इज ऑन, और उसको पता होता है कि भाई मैं तो पॉपुलर हूँ, लोग मुझे जानते हैं, मेरे होर्डिंग्स लगते हैं. तो इस दौरान जब उनका दिमाग जो होता है, बिकॉज वो बच्चा है, और बच्चे को अगर आपने कुछ भी, यू नो, एनीथिंग व्हिच मेक्स हिम शाइन एंड ब्राइट, तो उसको अच्छा ही लगने वाला है. एंड उन बच्चों का जो दिमागी जो विकास होता है वो बहुत अलग होता है आम बच्चों से. हमने हमेशा ये देखा है, बिकॉज जितने भी एक्टर्स बच्चों के साथ काम करते हैं उनको पता होता है कि जब वो आते हैं और जब शो खत्म होता है उसके बाद उनकी पर्सनैलिटी पे बहुत चेंजेस आते हैं हर एक तरह से, बिकॉज यू फील दैट they are no more a child, you know, and they know what popularity is, they know what money is, they know what success is. And because of that, the child goes through a lot of changes in the personality. Can you just give us more detail on how a parent or how a co-actor or how a production house should be dealing with the child in this particular aspect where a child is an actor also, definitely a well-known actor, but इसके साथ ये सब चीजें जब जुड़ जाती हैं तो the child becomes very very confused at that point of time. So can you just tell us what should be done for that? And we have one more question coming in from Roopal Tyagi also on this, so we would like to play that question also.
Okay. 1 minute. Somebody has written, children have stopped imagining. Absolutely, because they are challenged with having to imagine games or activity and are filled with digital content. Absolutely. वो imagination ही नहीं रहा बच्चों में, वो creativity ही नहीं रही बच्चों में. जब children come to me for counseling because when they have free time, they don't know what to do in that free time.
Yes.
Because their activities are so structured in life. Okay, 3 से 4 ये class, 5 से 6 ये class, 7 से 8 ये class, ये करना है. So when they actually had time in the lockdown, they didn't know what to do. So because of that, they are seeking therapy. It's so sad.
Yeah, yeah.
You know, जब हम बच्चे थे, we would go down and play. We would not even think about all this.
And boredom was not the thing के bore हो रहे ऐसे कोई बोलता ही
नहीं, पता ही नहीं है boredom में क्या करना. They don't know.
True.
So this is a very, very important thing. They've stopped imagining completely. They don't know what to do with their time. Yeah,
and
let's play the question.
They have become little socially also very late.
Very awkward, especially because of this pandemic also.
True.
And their whole life, especially the older ones, like from 6th standard, is only Instagram and Facebook. Mostly Instagram and Snapchat. अरे इतने followers है, एक follower कम हो गया, क्यों कम हो गया? You know, their whole world is that.
Yeah.
It's a complete make-believe fake world that they live in.
True, very true.
Yeah, please, the new question.
Yeah. We'll just take the video first.
Yeah, please.
From Roopal ji, and then we will definitely move forward.
Hi, my name is Roopal Tyagi and I have a question for Husna. So how does one detect mental illness in children? Anxiety, depression, etc. Also, are the remedies the same as compared to adults or is it different? Thank you.
Thank you, Roopal. Indeed, a good question. So for children also, any change from their regular habits. So when they become unusually very quiet, withdrawn, when they're sad, when they don't eat or they eat too much, when they can't sleep, when they don't interact with friends, family, prefers their own company. A child who was socially very, very active, doesn't want to meet friends. He keeps fighting with friends. He or she fights with friends, very aggressive, outbursts of anger, throwing tantrums very often, irritable, चिड़चिड़ रहता है बच्चा. अगर वो किसी को बुली कर रहा है, आपके ध्यान में कोई आके कंप्लेंट कर रहा है, आंटी आपका बेटे ने मुझे बुली करा, don't laugh it off, please. The child who is bullying also has a problem. It's not only the child who is being bullied.
Correct.
So they both have problems. Okay, so if he's a bully or he's getting bullied, if there is bedwetting, very important sign to watch out for. If the child restarts the bedwetting, so that is also important. Becomes unusually forgetful. Again, psychosomatic illness, so stomach ache, headaches. जब school रहती थी, हमको school नहीं जाना है, सर दुख रहा है. Avoiding school, missing school. अब तो online bullying हो गया है, which is a new trend. So I have this one other girl also, 13-year-old. She was getting so bullied, so much trolled online by her school friends. इतना उसको trolling and bullying होता था. That girl actually said, 13-year-old child, that I want to end my life because she's going to one of the top IB schools in Bombay. Okay, her parents took her out from an ICSE school because यही चीज वही हो रही थी. अब उसको IB school में डाला बॉम्बे में. अब वहाँ पे भी यही हो रहा है. She wears a brace for her back because she's got a problem with the back. So the boys were very rude to her and told her that you're so ugly and you're so terrible and you know you need to, I mean, very, very mean things. And the girl actually thought of ending her life. So this is very common again, cyberbullying. Again, severe aggression, severe mood swings. Sometimes children also become very clingy to their parents. Yeah. They have vomiting, bouts of acidity, difficulty concentration. Another thing is poor decreased academic school performance. If a child's school performance just declines completely, then again it's a cause of concern or a worry. Secondly, in cases of sexual abuse, we've also seen that sometimes, you know, sexual abuse with children only happens within somebody known to the family, of course, right? So supposing if the child says, Mama, I'm not comfortable with this uncle, normal parents will say that, nahi, kya hai, uncle to itne achhe, jao unke paas, right? But take that, keep your antenna up if the child is saying something like that. These are normally what you see with children mental health. These are the main symptoms. Something is off again with the child, basically. Right now, the remedies what we use for younger children who cannot communicate properly, we use a lot of play therapy, toys. Play therapy, there's art therapy, there's something called narrative therapy. We show them pictures, you ask them to describe what they see in the pictures. With older things, talk with older kids. You can talk to them, psychotherapy, but you have to come down to their level. Another thing is you use a lot of humor when you talk to the children. You can't be serious, so you have to be a time pass. Karo bachcho ke saath mein, talk nonsense with the child. And then you kind of get into that whole therapy process with the child. So basically, this is you talk to the child also.
Jayati is writing a very interesting thing. She's saying that listen to what child is not saying.
Another thing, yes. So now, हमारे Indian families में क्या होता है? Indian parents, okay? We don't talk to our children. We talk at our children. So what do? We are only giving our children instructions all the time. ये करो, वो करो, खाना खाया, खाना. Indian mothers are obsessed with food, including me. Okay, खाना खाया, नहीं खाया. That's our target. बच्चे ने खाना खाया, so we feel the child is happy. ठीक है, खाना खा लिया ना. Including me, I'm one of them. Okay, so खाना, ठीक है. So we are only instructing the child. We don't talk to the child, right? Ask the child, how was your day, beta? आज क्या हुआ स्कूल में? क्या किया? Friends ने क्या किया? Don't judge. If you need to correct the child, hear the child out. सुनो उसकी बातें. After some time, after 2 hours or 3 hours, then tell the child, बेटा आपने ये बोला ना मुझे अच्छा नहीं लगा. So when the child is angry, he won't want to listen to you. Once he cools down, explain it to him. These are the remedies what normally you can use when working with children.
So things have become very competitive, as we see. Everybody wants to be the best. Everybody wants to do the best, no matter what. And especially for actors, I would say, because as it is, it's a very competitive field. And mostly what happens is that every time you have to be, like, you feel that you're being judged as a performer. And definitely when you try to give your best, because everybody is trying to give their best only, whatever they do. And we have this process of auditions, where we have to give auditions for whatever role you are playing, you are giving your audition. In that particular audition, the thing is that you've been auditioned for a part. Now that is only one part, and there are so many actors who are auditioned for that one part, and only one person is going to get that part for sure. But you are being auditioned, and the thing is that many a times you are rejected, because you don't fit the part for some or the other reason. And that is one major thing which an actor has to go through, like so many times in his life. That is the rejection. So that is a big thing to take it all the time. And it's not like, that the part is over, the film is over, and okay, like new role, new film, new show, again that process starts. And and you are a part of that process, on and on. We have a question coming in from Rajeev also. He's been asking about the same thing as to what an actor goes through, as a person there, because that you've chosen a profession like that, where you will be judged all the time, from a director, from your co-actor, from even the production wala to the spot wala who is there on the set. He's also judging you how good or bad an actor you are. So you are always in this public eye all the time, being judged. So what an actor goes through and what can be done about it? Please answer Rajiv's question also, and I have even put in my question as well.
Sure.
हुस्ना जी, मेरा आपसे एक सवाल है जो कि मेरे लिए नहीं बल्कि हमारे समस्त एक्टर बिरादरी के लिए, हमारी फिल्म इंडस्ट्री में बहुत सारे लोगों के लिए सवाल वैलिड होता है कि एक आम इंसान जब एक नौकरी करता है तो उसकी नौकरी कई सालों तक चलती है और कई बार तो एक ही नौकरी पूरी जिंदगी करते हैं। लेकिन हम एक्टर्स की जिंदगी में बहुत सारे उतार चढ़ाव आते हैं। जब हमारा एक काम खत्म होता है और एक काम से दूसरे काम के बीच में जो गैप होता है उसमें हमें कई सारे रिजेक्शंस किसी न किसी वजह से फेस करने पड़ते हैं। तो हर एक्टर अपनी जिंदगी में या एक हफ्ते में इतने रिजेक्शंस फेस कर लेता है जो कि एक आम आदमी शायद पूरी जिंदगी में 10 जगह रिजेक्ट नहीं होते नौकरी के लिए, बट एक्टर्स को हर बार रिजेक्ट होना पड़ता है। तो रिजेक्शन से कैसे डील किया जाए और उसे कैसे कोप अप किया जाए, हाउ डज इट अफेक्ट आवर मेंटल हेल्थ एंड व्हाट इज द राइट वे सो दैट इट डजंट अफेक्ट अस, आवर फैमिली लाइफ एंड आवर सोशल लाइफ एंड हाउ वी कैन डील विद इट इन आवर लाइफ.
Thank you, Rajeev, for this question. It's a very interesting one. So firstly, you need to accept that rejection is a part of this profession. Don't take the rejection personally. They are not rejecting you personally. They are rejecting you for the role. Very important. There is a difference when somebody rejects you or when they reject you for something. So they are rejecting you for the role. Maybe you did not fit the vision which they had in mind. For example, if they wanted somebody with a particular body build or somebody with a particular rustic accent or something like that, you didn't fit it. So it's okay. So it's not, don't view it as personal that they have rejected you. It's you for the role. Very important. Secondly, after being rejected, it is very normal. You feel upset, you feel sad, you feel angry. So you need to get in touch with your emotions you are facing. Don't suppress them, address them. Cry if you wish to, just let it out of your system. Then one more important point is that maybe if you are constantly facing rejections, then you can ask for feedback. So ask for criticism and work on your flaws. So I had this other young actress from CINTAA who was undergoing depression because for 6 months she was giving auditions constantly and she was getting rejected completely. All the time she would get rejected. So she came for therapy and all that. I just gave her a suggestion कि अगर 6 महीने में नहीं हो रहा है, just ask the casting directors, if you can, for feedback. Maybe there is something not right with your doing or whatever. Explore the option, right? She actually did it. So she asked 3-4 of her friends who were the casting directors. So they all told her the same thing. They all told her that you're moving too much during the scenes. Okay? So she took that in a positive way. She worked on that. And today she is doing multiple projects. She just messaged me saying that I've got a good role in even the web series. So take the criticism also positively if you can. Secondly, when feeling low, remind yourself that you are not alone in this. Everybody in the industry has faced this at some point in their careers. Many are still facing it as you face it. So you're not alone. Also, lastly, it is very, very, very important to have a good self-esteem. What you think of yourself, no matter what others say, it will not affect you as much. So when you have faith in yourself, when you know that you are good, you're convinced that what you're doing is good, then nobody else would matter. Also remember that acting is your career. It is not you. Like being a counselor is not me. It's my profession. So being an actor is not you. That is your profession. It's your job. It's not who you are. So learn to dissociate the profession from you.
And it's just a part of your life.
It's
not
a
your
part of you. It's a role which we are playing. It's a ball which we are juggling.
Right.
So you are an actor. You may be a spouse. You may be something. You may be a dad. So you may be an actor also. So this is one part. So don't let it engulf you.
Correct.
Somebody has written me a direct question which says, I don't know what this means. Good afternoon, man. After this webinar, can we get a chance to talk with actor, actress? Okay. I don't know what this means. Okay, anyways, next.
Yeah, so as we were talking about the rejection part, now what happens is you said that, that your self-esteem has to be good. If your self-esteem is good, you can, it doesn't matter what anybody or whatever is happening. Now, due to this pandemic, what has happened is, people have had a lot of faith, people are positive thinkers, everything is fine. But what happens is, especially the senior people, like they are not very young, not very old, the mid crowd, what you say. For those actors, what happens is that they've had a very good career due to the pandemic. Right now you're not getting that great roles, you're not you're not being offered a very good pay packet, what, because everything, the pandemic has its post-pandemic effect also, and so does this industry. So because of that, what has happened is a lot of senior people who are senior in the industry, not senior in the age, I would say, but who've been working for years. And today when they go back and they're not getting that kind of a role, they are not getting that kind of a pay packet. And for them to accept that part, the acceptance, is a very,
very tough.
Yeah. So Jayati has a question on that, what does one do? Because you realize, you know that it is a pandemic effect, everything, but where you have been or where you had been to step down, you feel that you are stepping down, but it is just a matter of acceptance, because the whole world has gone through this. It's not only the actors or you and me who are going through this, but the entire world has gone through this. But the part of acceptance is very difficult. We'll take up Jayati's question first and then move on.
नमस्ते, मैं हूँ जयति भाटिया। मेरा सवाल ये है कि सभी लोग यंगस्टर्स के डिप्रेशन, उनकी इनसिक्योरिटीज़ के बारे में बात करते हैं, पर मैं बात करना चाहती हूँ मेरे कंटेम्प्रेरी एक्टर्स के बारे में, हु आर इन द एज ऑफ 40 to 60। सब मेन लीड कर चुके हैं, अब मैच्योर रोल्स कर रहे हैं, लेकिन बहुत सारे जो मेरे कंटेम्प्रेरीज हैं वो इस वक्त घर बैठे हुए हैं। मेरी ड्यू टू रीज़न, बिकॉज वन इज़ बिकॉज ऑफ पैंडमिक एंड बजट कट्स, जिसकी वजह से हमें प्रॉपर रेम्यूनरेशन नहीं मिल रहा, और दूसरा मन मुताबिक रोल नहीं मिलता। तो अब इस उम्र में हमें कुछ और आता भी नहीं है, तो वो लोग क्या करें? हाउ टू डील विद दैट इनसिक्योरिटी, हाउ टू डील विद दैट लोनलीनेस, हाउ टू कम टू टर्म्स दैट टाइम्स हैव चेंज्ड एंड यू हैव टू चेंज अकॉर्डिंग टू टाइम। प्लीज हेल्प। थैंक यू सो मच।
Okay. Firstly, one needs to accept that, like any profession, acting is also a profession, and that age is a part of life, and you need to mold yourself with age and time. So we, even in the professional industry, we do have people who are bankers, at top levels, and they have to retire with their age, and they have to take what they get then. Okay. Secondly, similarly with acting, you may not get the best of roles which you may get when you have been younger. So you have to learn to compromise. You have to learn that, of course, right? You can't get what you got when you were at 25 and 30. Your body is not the same. Things are different. Everything is different. The competition has increased. So you have to learn to accept that, okay, I will not be here, but at least I'm getting to follow my passion. And I'm getting what I know best, getting to do what I know best. Once you get that understanding, it makes your life easier. Like I remember I was working with one other actor from your thing only, and he was like, मुझे ये रोल नहीं करना है। उसको आ रहे थे रोल, ऐसे नहीं कि नहीं आ रहे थे रोल उनको, लेकिन उनको करना नहीं था। मैं यहाँ पे था, मैं अब यहाँ पे कैसे हूँ? So it's okay. Even the top guys go through it. Everybody goes through it. In any profession, it goes through it. It's okay. As long as you're getting work, as long as your kitchen is running, as long as you're getting to do what you enjoy and what you like, please make compromise with yourself and do it. Don't keep that ego in you that I can't do this. It's okay. Secondly, if you have your hobbies, make time for your hobbies, relax, something what you've been, because you are working so long, you haven't had time to do. So take out time for that. Think of it that, ठीक है यार, ये मेरा retirement plan है. सबके retirement plans होते हैं, right? Professionals के भी होते हैं. तो gardening कर लो, find something what you're passionate about and do this. You can even use your acting skills constructively. You can conduct workshops. You can mentor younger actors. So again, your confidence is high when your skill is being noticed. When you feel good about yourself when you mentor young people. And when you mentor, again, don't attach your self-worth only to acting. You are much more than your career. That is the mistake we all do. We think we are actors, or we are this, we are bankers, or we are this. No, that is a part of you. You have many other dimensions to yourself. Right? So the first thing is accept, move on, keep your ego at the side. What you're at least getting to enjoy what you're doing. And again, don't attach yourself to acting. Mentor, conduct workshops. If you like writing, hone your writing skills, because you've been a part of this industry for so long. Try and diversify into something. So don't get stuck कि मुझे यही करना है. Problem आती है जब हम stuck हो जाते हैं कि मुझे यही करना है, मैं कैसे ये करूं, ये तो मेरे standard से low है. Learn to adjust.
You have to
You're mentally stuck. You don't want to explore. That is the thing.
Right. Zeeshan Khan has got a question on FB. He's saying that, hi ma'am, जो कोई काम नहीं मिलता तो बहुत ज्यादा टेंशन होता है, तो क्या किया जाए कि टेंशन ना लिया जाए?
Again, very important. Tension नहीं ले रहे हो, आपको anxiety हो रही है, of course. Okay, naturally काम नहीं है तो. So one other CINTAA actor came to me. So he was also in the same boat, not getting work, but he was qualified. So he started giving kids tuition. So he did something else to supplement his income. And use this time to grow. Use this time to work on yourself, to work on your bodies, to learn something new, hone your skills, hone your acting skills. Use it constructively. Worrying will not get you anywhere. True. As we said, anxiety is all in the mind.
Right. There are a lot of people also wanted to know about what is bipolar disease. What is it? What is a brain fog? Because when somebody asked about brain fog, even I was like, I don't know what it is, because I've never heard something like that. And many a times when these terms come up, they're like, they're so connected or they are not connected. We don't know, because as a lay person, I would know. I don't know what is a bipolar. I would not know what is a brain fog. And sometimes when you Google, definitely you get the answer. But if as an expert, if you have to just tell us, like us laymen, what it is, I would like to know from you what it is. Like what?
So bipolar and brain fog are completely different. Completely different. Okay. Bipolar disorder is used very, very loosely by people. तो कभी भी हम देखते हैं कोई बहुत ज्यादा happy हो रहा है या sad हो रहा है तो हम बोलते हैं अरे तू तो bipolar है. I have patients and they have simple mood swings every day. They come, ma'am, I think I've got bipolar. Again, thanks to Google auntie. Again, thanks to Google. मुझे bipolar है. Mood swing contact करो, ये आ जाएगा. Type. One of the things will be the bipolar disorder. Okay, but bipolar is a mood disorder wherein you have periods of highs and lows. There are two phases. The phase one is the manic phase, where the energy levels are crazy high. The person is constantly talking non-stop, hardly sleeping for 1 to 2 hours, thinks he's superhuman, he can do anything. I have had patients with bipolar disorder. They actually open the window and they're ready to fly out because they believe they can fly. Okay, so this is the manic phase. Manic phase lasts for about a week or so. After that, there is a depressive phase, which can go on for months together, wherein you have typical symptoms of depression. Again, in bed, they're sleeping all the time. They don't have interaction with the outside world. They don't want to do anything in life. They're constantly sad. They're constantly low. So this is bipolar disorder in a crux. You need to go to get assessed. So you need psychological evaluation. You need a proper report. You need to be on medication lifelong. And you need to do therapy lifelong to be able to cope with bipolar disorder. It's not any normal run-of-the-mill disorder like anxiety and depression, right? So you need medication. You need to first get evaluated with testing that you actually do have bipolar or not. And you need medication lifelong and you need therapy.
Okay. And
brain fog.
Yes. Naveen Pandita has a question on brain fog. He wants to know what it is. So can we have his question as well, please?
मेरा एक सवाल हुस्ना जी से ये रहेगा कि मैं ब्रेन फॉग के बारे में जानना चाहता हूँ कि ये क्या है, इसके सिम्टम्स क्या हैं, क्या इसका कोई क्योर है और इससे कैसे डील करें. धन्यवाद.
Hi Naveen, thank you for your question also. So brain fog is characterized by confusion, forgetfulness, lack of focus, and mental clarity. The causes of brain fog could be overworking. जब हम बहुत काम करते हैं, so many hours, our brain gets foggy. We don't know what is happening. Lack of sleep, very important. Too much of stress, spending too much time on gadgets. Sometimes it is also linked to a nutritional deficiency. or even a thyroid condition, or even depression, eating too much, eating too little, chronic stress, certain medication, menopause in women, etc. The treatment is spend less time on your computer or gadgets, reduce stress, change your diet, get your vitamin level checked, assessed, get enough sleep, regular exercise, avoid substance abuse. This is brain fog. Okay. Somebody's asked a very interesting question. Apart from medication, what else is required to cure depression? Okay. You don't always require medication to cure depression. It's not always required. If you come in the initial stages or even mild to moderate, yeah, it goes away with therapy. So you don't always require medication to cure depression, right? If you have a good qualified therapist, it'll help you. So it's not necessary you would require medication always.
Okay.
It's a very, very important question.
Definitely. And I'm so glad that people are asking.
I'm very happy too. Yeah, I'm very happy.
Yeah. And you know, the best part about this is, Husna ji, that it takes a lot of courage for actors who are seen, you know,
absolutely,
and so image conscious also. And all these actors who have come and they've asked their questions for us also. And, you know, like it's a great thing where you come up and you ask, because it's so much of stigma related to this particular mental illness and stuff like that, that people don't ask questions. And today on this forum, all my colleagues, my friends, they've all asked these questions, and it's a great step forward, I would say. And one more thing I would like to say is that as an actor, it really requires a great courage to, you know, put forward this step and be there on a social panel and ask these questions. Thank you so much from my end that you all have asked these wonderful questions. We have had a very
from
great,
my side also, because what we need is awareness that there's nothing wrong if you seek help. So I'm very impressed and very thankful to all the actors who have actually taken out time and asked questions. Yes. Really, from the bottom of my heart, a big thank you to all the actors who have asked these questions.
And as we are ending the session now, I would like to ask you, what are the tips of good mental health? And I will take one more question from Remya ji, because she's been asking this question.
No, I am going to address all the questions after we finish this.
So how to build faith in oneself in spite of negative surrounding?
So again, it all stems down to your self-esteem and what you think of yourself. It again depends. It all stems down to what we think of ourselves. Agar humko koi, you know, what negativity hai, but if we think we are good, if we think there's nothing wrong with us, no matter how negative and how toxic the surrounding is, it will not have any impact on us. So the whole thing stems down to what we think of ourselves.
Right.
Then the outside will not matter. Okay. I don't want to comment on this Sushant Rajput's taking. I don't want to comment on this. Let's keep out of this.
Yeah, because we have very
because we don't know so yeah, we have limit, and I wouldn't want to comment. But the only thing I would want to say is that if you have been advised medication by a psychiatrist, this is completely unrelated to this case. Okay, but if you have been advised medication for a psychiatric condition or a psychiatric illness, you cannot stop taking the medication without the psychiatrist stopping it. So you cannot stop taking the medicine on your own. You cannot taper the dose on your own. You need to consult the psychiatrist if you have to stop, if you want to stop the medication. So for example, if you are getting some side effects or you think that the medication is not suiting you, you cannot stop the medication on your own. You should not stop the medication on your own. Consult the psychiatrist and then see what he says. This is completely unrelated to this case.
Yeah, this is a very important tip.
Okay. Now, what are the tips to stay mentally fit? First thing, value yourself. Avoid criticizing yourself. Treat yourself with kindness and respect. Very often, something good happens to us. We don't value ourselves. नहीं यार, वो तो हमारा लक अच्छा था ना, लक हो गया. क्यों भाई, आपने मेहनत की है, आप बोलो, अपने आप को value करो आप. Make time for hobbies. Set aside some time for yourself every day, whatever you enjoy, whatever you like doing. Take care of your body. Eat healthy. no substance abuse, exercise. Too much exercise is also not good. Maybe next time in another webinar, we will try and talk about this also. Go outdoors, spend time in nature, lead a disciplined lifestyle, adequate sleep. Surround yourself with positive people, very important. When you surround yourself with negative people, a lot of negativity enters your life. तुम खुद ही negative सोचते रहते हो. Volunteer for a charitable cause. Feel happy, helping others without any gain. Very important. When you help somebody, you feel that happiness and that satisfaction within you, that you know that you're very happy. किसी और के लिए कुछ किया. So try and give yourself sorry, I'm just reading this message, so I'm getting a little distracted. Okay, so you volunteer for a charitable cause. Be happy. Learn how to deal with stress. Set realistic goals for yourself. Very important. You have come new into the acting career. You cannot think that I will reach the top in 1 year, 2 years. No, it happens slowly. So set realistic goals. एक छोटा goal आपका set हुआ, reward yourself. Then go on to the next one. Then go on to the next one. Don't aim for the highest or the topmost thing at the start of your career. It doesn't happen. Every profession there is a slow rise.
True.
Then, most important, be grateful for yourself. Be grateful for what you have in life. The minute you realize that you are in a better position than other people, all your negativity, all your toxicity will go. Gratitude works like magic. Lastly, seek help when you need it. Even yoga, meditation, everything helps, of course. But seek help when you need it. There is no harm. Like Vaishalee also said that, you know, it's people don't want to come. Stigma hai. भाई क्यों स्टिग्मा है? बॉडी में कुछ गलत होता है, पेट आपका दर्द करता है, हार्ट के पास आप जाते हो, हार्ट स्पेशलिस्ट के पास जाते हो, हार्ट में प्रॉब्लम होता है, उसके पास आप जाते हो तो बोलो प्लीज मुझे और आप देना ना मेडिकेशन, वो आप करते हो. लेकिन यहाँ तो आपको किसी से बात करनी है आके, तो भी आप नहीं करते हो. मतलब आपका माइंड, लाइक आई थिंक दीपशिखा said in one of the videos that आपका माइंड ठीक नहीं है, कुछ ठीक नहीं है. Right? So with this I end. I'm open to questions. Sultan is saying something. Yeah, he's already taken 2 sessions with me. I'm very glad, Sultan, you are speaking about this in public. Thank you so much. On some of my family members, this session again is great where various topics of psychology is discussed. Thank you, Sultan. I'm so happy that you at least told people you've come to me for help and it has helped you. Thank you so much.
It's a big thing. It's a
big thing you said. Thank you so much. You just actually made my day.
That was Husna purposely done because I wanted to do that. By the way, you have spent your time with me as well on one of my
family members. Thank you so much, Sultan. So
that I wanted to throw up on the public.
Thank you so much. I really appreciate it. You just made my day.
I expected that.
Thank you. Thank you so much.
Yes, and anybody who wants to consult.
Mr. Sanjeev Kumar Seth has raised his hand. He wants to ask something. Yes. Yes, Mr. Sanjeev Kumar, please unmute. Okay, can we take the other questions? Any other questions?
My psychosomatic question is still to be answered.
Yeah. What's your psychosomatic, Sultan? बोल दो ना, माइक चालू है तो आपका प्लीज.
हाँ, मेरी एक फ्रेंड है बेसिकली, तो she has suffered some traumatic past, right? So she says right now she is having certain.
You got cut. 1 minute. Yeah, I have a question on psychosomatic disorder. Can you throw some more light on it? Yeah. So psychosomatic disorder is when there is actually nothing wrong with your body, right? It's in your mind. Like I said, जब आपको एंजाइटी होती है, सिंपल चीज एंजाइटी होती है, आपको खाना खाने का मन नहीं करता है, फिर आपको एसिडिटी हो जाती है, फिर आप डॉक्टर के पास जाते हो तो बोलेगा आपको एसिडिटी है. बट एसिडिटी क्यों है? क्योंकि आपने खाना नहीं खाया है. खाना क्यों नहीं खाया है? बिकॉज इट इज रिलेटेड टू योर माइंड, बिकॉज यू आर अपसेट. सो दिस इज साइकोसोमैटिक डिसऑर्डर. So when there is nothing wrong with you physically, it's in your mind. So the mind is affecting your body. That is psychosomatic disorder.
True.
जी मेरी आवाज आ रही है अभी?
हाँ आ रही है. बोलिए.
एक्चुअली हाँ, नमस्कार जी. हुस्ना जी, एक्चुअली पहले जो आपका सेशन हुआ था उसमें भी मैंने एक बात की थी अपने बारे में कि मैंने जो मुझे डॉक्टर ने दवाई दी थी, मैंने कैसे, अभी आपने दवाई की बात की, दवाई एकदम नहीं छोड़ना चाहिए, तो मैंने उस टाइम भी बताया था कि मैंने दवाई एक्चुअली छोड़ी थी बिना डॉक्टर को कंसल्ट किए, बिकॉज मैं डॉक्टर को कंसल्ट नहीं कर पा रहा था उस वक्त। तो मैंने इंटरनेट पे सर्च करके उस दवाई को स्लोली छोड़ा था, लाइक डेली डोज को पहले 1 दिन छोड़ के किया, फिर 2-2 दिन का गैप देना शुरू किया, फिर धीरे धीरे उसको छोड़ दिया था। अच्छा, दूसरी चीज आप टिप्स दे रही थी ना, तो मुझे एक बड़ी अच्छी टिप याद आई जी, स्पेंड टाइम विद चिल्ड्रन। एक्चुअली मेरा अपना एक्सपीरियंस है, ओपन जिम में था मैं और इलेक्ट्रिकल एक्सरसाइज में काफी लगा रहता था। एक दिन बच्चे आ गए वहां पर, तो उनके साथ बात करते करते मैं
बहुत मजा आता है,
तो बहुत मजा आया। उस दिन मैंने फील किया कि यस, आज मेरा सारा स्ट्रेस निकल गया।
बहुत, और
वो कहा कि बच्चों के साथ खेलो तो हेल्प
बहुत
मिलती
मजा
है।
आता है। अच्छा, अभी जो आपने मेडिसिन आपका टेपर किया, ओके, you were lucky it did not have any serious side effects on you. So you cannot taper. Again, as I said, Google auntie. Maybe your medicines were not so strong, right? So what you did is not advisable at all. At all. Okay, you tapered it. Google auntie आपने दिया, आपको advice मिला जो भी, but maybe your medicines were not strong. So next time in future, remember, if you ever, please don't do this. Please don't do this. Go back to the doctor, talk to the doctor. There is no problem in talking, right? Talk to the doctor. You need to do that.
Okay.
Right?
Okay. Thank you.
Okay. No problem. Thank you. Acha, anybody else ka question hai, or should we end?
I think we've taken mostly all of them. One thing I would want to say, anybody who wants to consult Husna ji can connect with the CINTAA office and we will get you connected with her. So that is one thing which is open for everybody. I hope everybody takes this opportunity. Whoever needs it, of course, just don't come looking for her, just otherwise.
Yeah, see, Nupur is asking, being criticized since childhood. Yes, of course. So your self-esteem is actually based on your family, right? As a child, what you are told. Like I discussed that case of that 52-year-old professional man. His dad had conditioned him like that. So his self-esteem was completely zero, right? Which is why he got triggered because of the boss.
Right.
But I think we have answered all the questions.
Yes.
Yeah, one minute. Jaya has asked, most people think that going to a psychologist means there's something wrong with our minds related to madness. That's a big hurdle. Yeah, exactly. Like I remember I got one client from somewhere up north, a young guy, 21-year-old guy, and he was so scared. Before the session, he actually had an anti-anxiety medication. And after 10 minutes, he's like, ma'am, it's like you're just talking to somebody. But people don't know. See, it's not even their fault. They don't know. Now that you all are here, people have spoken out. Now you all know, okay, you're just talking to a neutral person. Usme kya hai? You talk to your friends, right? Here you're talking to somebody neutral.
True. Let me see if we Sultanji is saying that his battery while asking the question, so he couldn't complete the question there. I'll check for his question.
No, I've answered it. It was on the psychosomatic.
So he was
but I haven't heard the answer because I completed my question, but I was not able to hear.
Okay. So I'll just tell you. So psychosomatic means that तुम्हारे body में तो कुछ है नहीं गड़बड़, आपके mind is not okay, so your mind is playing tricks on your body basically. So a simple thing like you're getting anxiety is in the mind again. So you've not eaten, so you're getting acidity and you're puking out. Okay? That is psychosomatic disorder. So maybe there's nothing wrong physically with you, like a panic attack. That's again the psychosomatic disorder, right? Panic attack. The panic is getting created. You think you have a heart attack, but heart attack nahi, it's a panic disorder. So psychosomatic is when your body में कुछ गलत नहीं है. It's your mind which is problematic, which is why you're getting the physical symptoms.
Yeah, exactly. So my friend is having certain kind of a physical symptoms wherein even the doctors can't diagnose what exactly the problem is.
Yeah, so your friend requires to come for therapy.
Therapy, a psychotherapy, right?
Yes, absolutely.
Oh, fair enough.
Absolutely. And this will only help her. When the doctors cannot diagnose any problem, okay, you go for testing. Like I had one other kid, one other guy. He had a lot of these physical symptoms. Same thing. He was admitted in Global Hospital, And 6 months he was there. At one point, they even thought he's got cancer. Sab kuch kiya, nothing was wrong with him. Finally, he was sent for therapy to me. He came for therapy to me. After some sessions, he found out he had a problem of bullying at the workplace. Now, again, the whole image, man has to be strong. Man cannot be weak. He couldn't tell anybody, because if he would tell somebody, they would say, what kind of a man you are, yeah? You know, that kind. So again, he had internalized the whole thing. So again, there was nothing wrong with him physically, but it was the mind playing games. कभी पेट दुख रहा है, कभी इतना पेन वो आदमी ने लिया, इतने नीडल्स उसके बॉडी में पोक हुए, you know, and thankfully nothing came out of it. But this is what happens when you don't seek help. Somewhere or the other it comes out. You can't be strong all the time. Sultan, anything else?
It's okay. I'll take another session with you to discuss.
I know. I have to do that with you. Yeah, I'll connect with you.
Yeah.
Okay, then. I think we've had a very, very important questions coming from people. And we've tried to answer most of them. I think we've answered all of it. Thank you so much, Husna ji, for being on this platform with us on Mind Matter. And hope to see you again with more interesting questions. And we'll connect once more. I would like to end this particular session with reminding all of you all, anybody who wants to connect with Husna can connect with CINTAA first, and we will get you all connected to her. So we'll sign.
Also, the therapy is free of cost. This is very important. So there will be no charges for the therapy. Very important. So yes. we are doing free therapy for the actors. So please come forward if you all have help. If you all need help. Yeah?
Yes. So do join her. And if you want to get connected to her, I've already told you that you need to connect to CINTAA first. So let's round off the session here. Husna, lovely talking to you.
Thank you so much.
And thank you everybody who all participated. I'm sure they must have really taken something from her for sure. And it was our privilege to have her on this conversation. Thank you once again, and see you again on a different topic.
Thank you so much, everybody. It was a real pleasure being here with all of you all. I love the questions. I love the interaction. Thank you so much. Looking forward to seeing you all soon. Thank you so much.